I am thrilled to be here. Thank you all, and thank you for the overview with regards to the new song, which I'm going to take back to the health department, because absolutely it is a new song with regards to healthcare in the nation, Maryland, and for Prince George's County. So I'm just going to start off the top about what we're doing to do things a little bit differently. In the health department, historically, most of you had never known about us unless you had an STD or if there was an outbreak like measles. We were rediscovered during the time of Ebola, and but what we really are about is population health. And so there are a lot of things behind the scenes that we do. What our wonderful team, because it's not me, but I have a great team of people, what we are really about is making sure that we integrate with the community, with our churches, with our hospitals and everyone, because we've always known that the real health care is not happening at the hospital. That's acute health care. So now everyone has to help bring the cost down. And my background has always been about cost, patient, and quality outcomes. You can't work for Kaiser Permanente and not leave there without drinking the Kool-Aid, and that is the Kool-Aid there. And they do it better than most across the nation. So that's just who I am. So with regards to Prince George's County, I have to start off by talking about what we're doing in the Health Enterprise Zone that is very different. It is a complete look at how we're going to integrate the community. It started with the community and the coalition, and how we can get services to people in the community to help prevent them from having to go to the hospital, or if they have to go to the hospital, making sure they can land safely with a physician and have transportation and can get some of the connected to the mental health services they need to keep them out and from going back. So what we were funded to do in the Capitol Heights zip code, this is in that zip code, 20743, was to create, and all of this was around trying to see, it's a pilot, if we could impact outcomes with chronic diseases. You heard earlier about you didn't hear about heart disease, you heard about asthma, diabetes, asthma, hypertension. We have to, because we're that way, throw in that low birth rate too. So we're not just doing chronic disease, we're looking at a lot of the entities that are concerning us in Capitol Heights. So we were funded by the Maryland Commission, the Health Resource Commission, to do just that in this Health Enterprise Zone. Our goal was to open up 5 practices. In this zip code alone, we have opened up 3. The 4th one should happen in maybe 3 months. We are delayed with construction, but it's going to happen. We are hopeful and praying, and I'm glad we're here with the Collective Empowerment, because we all need your prayer that we will stay funded so that we can open up that 5th one. Okay? All right. We're in agreement. And so the goal is engaging the community around improving health outcomes. Next slide. So this is just a really neat thing, but at the center of this, when we talk about who we partnered with in this Health Enterprise Zone, the center of this is, I call this patient Rosa. That's my mother's name. She's no longer with us. She's been gone 8 years. But Rosa was the perfect kind of person that I want to talk about, who we're trying to put all things that she needs in the community so that she doesn't have to wonder what the next steps are. So this Rosa has chronic disease. She also has means, she's in a community much like many of the communities in Capitol Heights zip code, but she didn't know where to go and she had transportation problems. The way things are happening in this zip code, if you did not have transportation, or if you didn't know that there were behavioral health services at the health department, or maybe across your zip code, you kept going in and out of the hospital. So this diagram shows you how we have partnered with the hospitals, with the libraries, with our FQHC partners. Greater Baden is a big partner in that zip code. We have hospitals, Dimensions, Doctors Hospital. We partner with all 5 hospitals, particularly in this zip code. And the health department, social services, family services. Every agency in the government is participating with us in this project. So when we have a construction project where we're trying to negotiate leases, the county's Office of Central Services is involved at the table with the ministers or with the partners or with the doctor's practice, helping us move this along. Next slide. So the second phase of this project is our community care coordination team model, and we're most excited about that. So we understand that you've got to wrap all these things around the patient. And it can't be rocket science, and it can't be difficult. And what our pilot wants to prove at the end of this 4 years is that it is very intuitive and easy. It should be like breathing. So that's what we propose to do in this zone. We are still in that beginning stages. It still feels uncomfortable and weird, but we're pretty sure by the 4th year it'll be like breathing. For the most part, what we have found was the chronic diseases are prevalent. We are heavily a minority-majority community. So when you look at the disparities, some of that is understandable. Some of that will always lead the pack in some of these issues, but it's the maintenance of it. And I was sitting over there after listening to the last speaker. It really is take your meds, watch what you eat, and move. But if that's not easy for you, and if you don't really understand that, and if you're not hearing it from every healthcare partner at every point, not just at the hospital, we end up with disparities like we have. We end up with unnecessary ER visits, and we end up with admissions that could have been avoided if everything around you made sense and was easy to get to. Next slide. The last thing I'm going to do, because I know we all have 30 minutes, is really just to talk about community health workers. One of the things that we have none in Prince George's County outside of 2 perinatal navigators. We've got 5 that we were able to fund with this Health Enterprise Zone pilot. And what we're seeing is they really are making the difference. We have them in the hospitals. We have them connected with the providers that are our partners. What I'm learning, and we're all learning, because we treat this as a pilot for us to learn. So there's no good news, bad news. It's just data that we need to now talk about and do something different, is transportation is one of the biggest barriers to many things. Health literacy probably is second to that. People kind of know what they should do, but don't have someone making it plain so that they can get it done. And these community health workers in our department are amazing. They are on the street. I can't even tell you the caseloads that they're carrying, but they're making a difference. And so I just wanted to talk about, just for a minute, some of the different ways we are thinking with this new song. It is a fabulous song. I've been singing that song all my life. I think outside of a year at the hospital, I was a community health nurse. I was a community health nurse. We did this in the 80s. So the hospital numbers that have gone up and crazy. As soon as we changed some things, DRGs, a lot of things came to play. I used to be the visiting nurse in a senior's home, making sure these connections happened. And so that was part of my regular job. We got away from that, and now we're going back to that. I'm old enough to remember. Thank you so much.